So you want to go over that spore section again?
Sure. So a few years ago, the licensing body for dentistry, or the Royal College of Dental Surgeons of Ontario, published guidelines that we are supposed to follow and have to follow certain things. And one of the reassuring items for Ontarians is that dental office is mandated to do a daily spore test, and that actually not only shows that the sterilizer is functioning, which is indicated by this tape. This is an indicator tape that shows that the sterilization cycle went through. It's white when it's wrapped and it's dirty. Once it goes through the machine, it turns black. But that just tells you that the cycle went. It doesn't tell you that it's sterile. So the spore test tells you that the sterilizer is actually sterilizing, so it kills the spores.
Is this a random test or do you have to do it for everything?
Do it every day, and with equipment that is used for implants, we actually have to put one in every cassette. So every time that particular implant equipment goes through, it has one inside as well.
Wow, great.
And of course, I'm not the expert in this area. I rely on my team, but I'm very confident, and I know that they follow through with the guidelines because we have to. So,
oh yeah.
So if we move this way, we'll enter the hallway again. In the hallway, this is a central scheduling station. This allows us to kind of communicate and perhaps book appointments on the way out if there is a bit of a backlog at the business team. So business team member area, the receptionist area. So that's why this is here. And I'll move into this operatory. This is my feature main treatment operatory for more complicated dentistry. It's a little larger, as you can see, as compared to the hygiene operatories. And that's, primarily because there's always a dental assistant with me, or two, and we have a number of other technological items in here that I'll briefly go through. So the one of the items that I can't live without is the wand, which is a different delivery system for local anesthetic. Instead of the traditional syringe or needle, we use this piece of equipment to freeze patients, and the comfort level is quite good. And the main reason is it's extremely slow. Most of the discomfort associated with an injection is from the distension or the stretching of the tissues as the fluid goes in. So the faster you go, the more it burns, the more uncomfortable it is. This prevents you from going fast because it's controlled. And it works marvelously.
Must be a lot of patients that love that too, though.
They do, and children don't worry about it because it doesn't look scary. These are the disposable hand pieces that go on it. It's it's a tubing mechanism, and I'm basically approaching you with this, which looks like a ballpoint pen, versus a shiny silver syringe that's a lot scarier than that. So that's that. In this area, in most of the rooms, I pointed to cameras. These are digital intraoral cameras that can take a picture of any tooth, any surface in the mouth, and display it on the screen. It's very, very useful for patients to feel better about seeing what's going on in their mouths, and it allows them to make great treatment decisions and really buy into that they have a crack or that they have a cavity or whatever.
So people can actually watch what you're doing?
A lot of people do like to watch it, yes. There are definitely a portion of the population that doesn't want to see anything. They don't even like me to have this screen. They make me flip it up because they don't want to see their own reflection. So, there's a variety, and of course we're willing to do whatever it takes to make people happy.
Yep.
So, this is my latest technology addition to our practice, and I'm quite excited about this. It's actually it's a scanner, which means that rather large camera takes a picture of surfaces in the mouth. In other words, all of the teeth, some of the teeth, and digitizes it such that you don't have to take traditional goopy impressions anymore. It allows us to do Invisalign in other words, move teeth. It allows us to do every crown and bridge and implant procedure without actually using a rubber impression material. And the accuracy is phenomenal. So it eliminates small discrepancies that are inherent in regular dentistry, where you take a mold, it's a rubber material of some sort, there's a small bit of distortion. You pour a stone or a dental plaster in there to make a model, and there's a small bit of error, and then you make a crown or a bridge or whatever on top of that, and there's another small little error. In the end, materials and techniques have been perfected to the point that the errors that are added up are certainly workable, but this just eliminates that. I've been using it only for a short time, a few months, and I can say that it is amazing. It's the pictures are emailed directly to the lab. For instance, I believe on Wednesday or Tuesday of this week, we worked on a case, and within 10 minutes, the lab technician in Toronto that I work with was calling me and asking me a question about the case. He already had the model generated. It's generated from like a 3D plastic printer, basically, or a milling machine, which most of us have heard about in this day and age. And he can get going on the procedure, or on the actual end product. So it's pretty phenomenal.
It's amazing.
Yeah. This is the chair side version of that. So for the last 8 or 9 years, I've been utilizing CEREC technology in situations where it's applicable. It works for single teeth. So if you need a crown, or you have a filling that's so large that you need a porcelain inlay or an onlay, which is like a porcelain filling, we do a very similar method. We prepare the tooth, remove decay, whatever has to be done. We can take a picture of that with this camera, it's a little bit smaller, and design the crown or the onlay with that particular machine. And when we're ready and satisfied that it's going to work, we actually send it wirelessly to this milling machine, which takes a solid block of porcelain of particular color, shade that matches your tooth, and within 15 or 20 minutes it actually grinds or mills a crown or tooth from that particular block. I probably have some examples here somewhere of what one would look like, but maybe not. But this is what's left of that particular porcelain block. As you can see, it was a larger block like that, and these two diamond mills have ground, customized a crown or an inlay or an onlay or a restoration out of that. So, and this technology has been around for about a little over 20 years, and I've had it in my practice for about I think it's 9 years now, and it's really remarkable. So, and the convenience for patients is that they don't have to come back for a second visit. So most times with crowns and inlays, you would have to return, be numbed again perhaps, and have the inconvenience of having to come back. So it works really well. And again, it has those advantages of eliminating the errors. This is a diode laser. It's an older laser in that it's about 10 years old. It's used for soft tissue procedures, which means eliminating small lesions, taking biopsies, things like that that are sometimes necessary, or if we have to aesthetically contour gum tissue, where, like in particularly this picture that's on the wall, you might see that a couple teeth look a little short. The laser can actually very accurately just kind of almost melt away that gum tissue to make the teeth look exactly the same. So it's pretty neat.
That's amazing.
That's about it for technology.